What do you expect? You should have been here 5 months ago. My arms were sore where the nurse had drawn blood, but I squeezed them against myself and cried. The NP looked up to rub his dark, circled eyes. I didn't hear the rest of what he said. It didn't matter now. The receptionist said they'd call whenever they got my lab results. I sat in my car, numb, feeling betrayed. It was a fluke that I was even getting checked out. I'd made a comment about the incident to the nurse at the plasma donation center where I worked as a phlebotomist. She wrote a note for a post-exposure evaluation. I should have had blood work done immediately, been offered preventative medicine, and had regular checkups. The patient should have had current blood work done. It was a hard lesson. In a rush to disconnect tubing, I'd forgotten to clamp one down. Blood shot up like a geyser, then showered down, covering me from head to foot. A coworker quickly clamped the tube. Clean up and come back to work was all my manager said. It took 10 shampooings and endless scrubbings for the water to run clear. By the way, I looked at that patient's file, and her history's clear, she'd said. I paused, but she never looked up from her paperwork. For the longest time, I blamed myself for not pursuing the exposure further for my safety, until I became a nurse and I met Maxine. I was a new nurse and had been assigned to work with her in team member health. At first, it didn't seem like the kind of nursing I wanted to do. With Maxine, I learned about exposure incidents and how to manage them. I learned about outcomes and diagnoses, labs and medicine, and everything that should happen in a good functioning system. Maxine stayed late and tracked down information we needed so that people had the best outcomes. She advocated for better treatment options and called back with lab results quickly. She offered tissues, hugs, and a plan of action to scared medical professionals who'd been stuck by a needle. By teaching me how to take care of team members, Maxine helped me heal my sense of betrayal. We don't care for patients directly, but we take care of the people who do. Maxine was the nurse I wish I'd had, and the nurse I want to be.